Well, Natasha Piri is standing by for us at the Union Buildings ahead of that much-awaited, anticipated signing into law of the NHI Bill by President Ramaphosa. A very good afternoon, Natasha. Of course, we're anticipating that he's going to sign the bill. Not that long ago, in a live speech, he did reiterate that that's his intention, so it's really, really happening.
Definitely, Nompo, it really is happening. In just an hour or under an hour's time, President Cyril Ramaphosa will be rubber stamping and signing the NHI bill into law. And of course, Nompo, you would know very well. I mean, I was just listening to an interview that you had with somebody from, the medical scheme sector. And this bill has been applauded by some. This bill has been criticized by some, while others have lauded the efforts of government to ensure that everyone has access to comprehensive quality healthcare services if indeed they actually struggle in terms of financial hardships. Others have said that this bill is unconstitutional and takes away the rights of medical aid schemes to do business and compromises the rights of citizens' access to healthcare. But just to have a conversation further and unpack this for a layman's person who's watching us right now, I'm joined by Dr. Ntuthuko Bhengu, who's a National Planning Commissioner. Dr. Bhengu, thank you so much for joining us on SABC News. Dr. Bhengu, I mean, for a person who's at home, who doesn't have access to private healthcare, for them, this is a win. But I mean, others have criticized this bill, saying that how will we actually fund it? Yesterday, I heard the Minister of Finance, Mr. Enoch Godongwana, saying that it will be funded through an NHI fund.
Yes. No, good afternoon, and thanks for having me. Good afternoon to your viewers. Yes, definitely the issue of universal health coverage, our version is known as the NHI, is to ultimately make sure that every citizen has got access to healthcare services, not just healthcare services, but quality healthcare services at no cost at the time they're seeking care. The issue is to prioritize and make sure that those who need it, who need healthcare services, get it irrespective of whether they can afford or not. No one should go bankrupt seeking quality care. This is the gist of universal health coverage. Regarding the bill, certainly I'm not aware of anyone who could be against the principles of universal health coverage. Criticisms have been made against maybe the content, whether enough background work has been done or shared publicly, or whether there are enough protections given what the country will pay for it. As the National Planning Commission, in our role of strengthening the health system, and of course what would be such an important achievement for the country, we made our contributions and suggested how we believe it could be strengthened in the areas of governance, in the areas of sort of making sure that the right type of quality services are purchased, but also bear in mind that ultimately it's about building on what South Africa has.
And just sorry to,
good private sector,
yeah.
So we wanted to participate.
Sorry to interject. I like the fact that you mentioned the fact that it's on building what you have. Others have lamented the public healthcare system in the country, saying that how could you actually build on infrastructure that is actually dilapidating, especially in our public healthcare system?
No, but the issue is that it's the NHI is not so much a destination; it's a direction. Okay. So some view that you can never really have a situation where we say we now have enough so we can start. But it's about the way of implementing that's based on proper planning, which is where maybe we were questioning whether that had been done. But one also has to have a sense of occasion. It's a big day. As the Planning Commission, of course, once this is law, we'll have to sit back and say what now is our contribution. Because the issue of building, strengthening and making sure that what is good for the country is achieved is what drives us. It's our mandate. We are appointed in our individual capacities as experts in different spheres, but we are citizens first. So we don't forget that. And we are fortunate to be able to give advice, working with the Department of Planning, Monitoring and Evaluation to give advice to Cabinet. And we'll continue to do that. We are independent. We understand not all of our advice will be received well, because we do criticize. That was we asked. The main thing is to criticize in a manner that is constructive, that is respectful. But it is a new mark, and as Planning Commission will continue to do what it believes right.
Dr. Bhengu, in 30 seconds, we've been seeing some people on social media, coming up with jokes and saying, listen, they'll be walking in with a slight headache at any private healthcare facility and the NHI will kick in. Just remind our viewers that it won't be implemented immediately.
Indeed. Well, I will just first touch on that there obviously have been very public expressions that this will be challenged, and this is not news, it has been said. But even without that, even if it were to be started with no bottlenecks like that, it was never going to be an overnight thing. I mean, even this has been said by no less than the DDG of the NHI himself, that this takes a while. There is planning. There is...
Dr. Bhengu, unfortunately, I'll have to cut this, but of course you'll be with us throughout the duration of the day. And remember, just a reminder to our viewers, at 2 o'clock, President Cyril Ramaphosa will be signing the NHI into law. We will be joined by another guest at 1:30 to actually give more clarity to the NHI later on. With that said, it's back to you in studio.
Thanks very much. I don't know whether Natasha can still hear me. Natasha, can you hear me? Okay, so you can.
No, I can. I believe I can.
Okay, so I want to ask you, the president signs many bills into law quietly in a room somewhere. Why is he signing this so publicly? Why are we going to be giving this so much public attention when there are lots of other bills that are sitting on his desk?
Well, Nompu, this is not the first bill that will actually be signed publicly. If you remember last year, towards the end of last year, myself and my colleague were also here at the Union Buildings where the president had actually signed sign language, as a language into law. So this will also be public. It's nothing new that the president has actually signed this bill. But I also just want to bring something to your attention, Nompu. If I'll just step out of frame, I don't know if you can see the lawns of the Union Buildings behind me. We expect the Democratic Alliance had actually released a statement saying that right after the signing of the NHI into law by the president, they will be on the lawns of the Union Building briefing members of the media. And you would remember, Nompu, that DA leader John Steenhuisen yesterday had rallied and called upon members of civil society and also other stakeholders, private healthcare schemes, to actually join in his bid to actually take this bill to court, to the highest court in the land, the Constitutional Court. We've seen a number of political parties here. We've seen the leader of BOSA criticizing this bill, the ACDP, Action SA. We've seen lobby groups like Solidarity and AfriForum, Business Unity South Africa, all saying that they will challenge the NHI, especially in its current form. They will take their plight to the courts of South Africa. So I do implore our viewers, at 1:30 we'll be joined by another guest. 2 o'clock, of course, we'll be bringing those live visuals of the president signing that bill into law. Right after that, the health minister, Dr. Joe Phaahla, will be engaging members of the media with any questions that we actually have, especially around the funding of the bill, Nompu, and what this actually means for medical aid, stakeholders and South Africans, ordinary South Africans as well, and the implementation. How will this happen? But most importantly, Nompu, yesterday we heard the finance minister in conversation with Clement Manyathela talking about an NHI fund. How will you then ensure that this fund is not susceptible to corruption, as we saw with the COVID-19 fund? So all these questions and more on SABC News. So I do implore our viewers to stay tuned as we bring you the latest in regards with this top story.
Absolutely. Thank you so much for those various clarifications. My colleague there, Natasha Piri.